Is RDI or AHI more accurate for sleep apnea diagnosis? Have you ever wondered which measurement is better for diagnosing sleep apnea, the Apnea-Hypopnea Index or the Respiratory Disturbance Index? Let's break it down. The Apnea-Hypopnea Index, often referred to as AHI, counts the number of complete pauses in breathing, known as apneas, and partial reductions in breathing, called hypopneas, during an hour of sleep. This index is the standard tool used by healthcare professionals to diagnose obstructive sleep apnea and assess its severity. AHI classifies sleep apnea into categories based on the number of events per hour. If a person has fewer than 5 events, it is considered normal or minimal. Between 5 and 15 events indicates mild sleep apnea. Moderate sleep apnea is classified as having 15 to 30 events, while 30 or more events per hour is categorized as severe sleep apnea. On the other hand, the Respiratory Disturbance Index, or RDI, includes all the events counted in AHI but adds another layer. RDI also accounts for respiratory effort-related arousals, which are subtle breathing disruptions that do not meet the criteria for apneas or hypopneas. These disruptions can still interrupt sleep by causing brief awakenings. Because RDI includes more types of respiratory events, it is always equal to or greater than AHI. This means RDI can be more sensitive in detecting sleep disturbances that AHI might miss. For individuals whose sleep is affected by these less obvious respiratory events, RDI can provide important information that impacts diagnosis and treatment. When it comes to accuracy for diagnosing sleep apnea, both indices correlate well with each other and with clinical outcomes. Research shows strong positive correlations between RDI and AHI values obtained from polysomnography, which is the gold standard for sleep studies. However, since RDI captures more events, it may identify cases that AHI could overlook, especially in those with milder forms of sleep-disordered breathing. In practice, AHI remains the primary metric used by most sleep specialists for diagnosis and treatment planning. It is well established and standardized, making it a reliable choice. RDI can be particularly helpful when symptoms suggest sleep apnea, but AHI results are borderline or low. It may reveal additional breathing disturbances that affect sleep quality. In summary, RDI provides a broader measure of respiratory disturbances during sleep by counting apneas, hypopneas, and respiratory effort-related arousals. This makes it potentially more accurate in reflecting the full extent of sleep-disordered breathing. AHI focuses on apneas and hypopneas and remains the standard for diagnosis. The choice between the two often depends on the specific clinical situation, with RDI offering a more complete picture in complex cases of sleep apnea.